Colorectal cancer is a huge problem. It's the second deadliest cancer worldwide, causing over 930,000 deaths in 2020 alone. But in Greater Boston, Dr. Richard Birkett is taking it head-on. He's a top colorectal surgeon, using cutting-edge techniques and compassionate care to help patients live longer, healthier lives. Dr. Richard Birkett wears many hats. He's a colorectal, general, and trauma surgeon with an impressive resume. He's known for using advanced robotic and laparoscopic surgeries to treat colon and rectal cancer, diverticulitis, and other gastrointestinal issues. But he's more than just a skilled surgeon. Dr. Birkett is also a teacher, innovator, and athlete. He's a site director for surgical residents, helping train the next generation of doctors. He's written research papers and book chapters to advance medical knowledge. And in his free time, he's completed multiple Ironman races and marathons, often for charity. Colorectal cancer is no longer just an old person's disease. In the United States, 1 in 5 cases now occurs in people under 55. Even scarier, rectal cancer in young adults is rising almost twice as fast as colon cancer. By 2030, colorectal cancer is expected to be the #1 cancer killer for people aged 20 to 49. Dr. Birkett sees this trend firsthand. Colorectal cancer doesn't always show symptoms early on. That's what makes it so dangerous. But when caught early, it's highly treatable. In fact, 90% of early-stage colorectal cancers can be cured. Screening helps doctors find precancerous polyps and tumors before they cause problems. The US now recommends starting screenings at age 45 instead of 50. For those with a family history or certain genetic conditions, screenings may need to start even earlier. Even though early colorectal cancer often hides, there are some signs to watch for. Changes in bowel habits, like diarrhea or constipation, blood in your stool, unexplained weight loss, fatigue or low energy, persistent abdominal pain and anemia. If you notice any of these symptoms, don't ignore them. Talk to your doctor. Dr. Birkett specializes in robotic and laparoscopic surgery. These are minimally invasive techniques that use tiny incisions and advanced tools. Why does that matter? Smaller cuts mean less pain, shorter hospital stays, faster recoveries and fewer complications. For patients, it's a game changer. These surgeries allow them to get back to their lives sooner. Dr. Birkett believes great care comes from great teamwork. He works closely with oncologists, radiologists, and other specialists to create personalized treatment plans. By combining surgery, chemotherapy, radiation, and sometimes immunotherapy, Dr. Birkett and his team give patients the best shot at beating the disease. Preventing colorectal cancer starts with taking care of your gut. Dr. Birkett offers simple tips to keep your digestive system healthy. Eat more fiber fruits, vegetables, and whole grains are your friends. Cut back on red meat and processed foods, these can increase cancer risk. Stay active, aim for at least 20 minutes of exercise a few times a week. Don't smoke. Tobacco is a major cancer trigger. Limit alcohol. Too much booze can damage your gut. A healthy lifestyle won't just protect your colon, it'll improve your overall health. Dr. Birkett doesn't stop at saving lives in the operating room. With an MD and an MBA, he's also shaping the future of healthcare. He's worked on projects to make operating rooms more environmentally friendly and improve surgical tools. His unique mix of medical and business smarts helps him tackle big challenges in innovative ways. As a site director for surgical residents, Dr. Birkett is passionate about education. He teaches young surgeons not only how to perform surgeries but also how to communicate with patients and work with the team. When he's not in the OR, Dr. Birkett is likely running, biking, or swimming. He's completed multiple Ironman races and marathons, often raising money for causes close to his heart. In 2024, he ran the NYC Marathon for Camp Shriver, a program that promotes inclusion for children with disabilities. Dr. Birkett's motivation comes from making a difference. Whether it's saving a life, teaching a student, or supporting a cause, he's driven by the belief that small actions can have a big impact. He's also a big believer in the power of failure. The healthcare world is changing fast, and Dr. Birkett is excited about what's next. He sees huge potential in AI and robotics. These tools could make surgeries even safer and more precise, leading to better outcomes for patients. He's also passionate about raising awareness for colorectal cancer. With cases expected to hit 3.2 million annually by 2040, he believes education and early action are more important than ever. Dr. Richard Birkett isn't just a surgeon, he's a leader, teacher, and advocate. His commitment to his patients, his community, and the future of medicine sets him apart. Whether he's performing life-saving surgeries, training future doctors, or running marathons for charity, he's making the world a better place. For anyone concerned about colorectal health, Dr. Birkett offers hope and expert care. His message is simple: take charge of your health, and don't wait to get screened. It could save your life.